So I'm Dr. Nick Walla, and tonight I will be talking about some hip injuries in sports. I'm an orthopedic doctor that's trained in sports medicine, which is a conglomerate of different issues, mainly all issues of the shoulders, elbow, hip preservation, such as hip arthroscopy, and as well as a lot of knee issues like ACL injuries, meniscal injuries. But tonight we'll be focusing my part of the discussion on hip injuries. A little background on the hip. It's close to the core of the body, so less injured than some of the other parts of the body when we're talking about sports injuries. Approximately about 6% or so of all sports injuries involve the hip. It's a very complex joint. There's numerous muscles, as well as bony anatomy that are playing an orchestra to create a well-functioning hip. Um, and like anything in medicine, requires a systemic approach to making accurate diagnosis using history, physical examination, as well as a proper evaluation of different types of imaging. So the first topic regarding hips is one that we see pretty commonly in the sports medicine world, and it takes a little bit of a trained eye to appreciate it. But if you can see my cursor here on the left side, this is an X-ray of a pelvis, and this is a hip. The ball is here. There's a little bit of an overgrowth here where the cursor is, and it's a little aspherosity of the ball, and it can bump into the socket here, and that's what we call hip impingement. The medical terminology is a fancy word called femoral acetabular impingement, or FAI. It's pretty much the same thing as hip impingement. And what it is it's a dynamic issue that's caused by abnormal contact between the ball and the socket. And it's obviously a mechanical issue, so you get some overgrowth here. It's called a cam lesion. And you can also have overgrowth of the socket, which can cause that hip to impinge as you rotate it, flex it, and internally rotate it. And what that leads to is pain as well as decreased motion, particularly after higher impact activities such as sports. A little bit more insight into this. So the diagnosis of this um, is you have to have a thorough examination of the hip as well as appropriate imaging. And the treatment for it, we start conservatively, as you've heard. A lot of things in orthopedics, we try to, take care of the problem non-operatively, which would involve physical therapy, which would be in targeting flexibility of the hip, as well as some core strengthening, and then anti-inflammatory modalities like ibuprofen, Aleve. And then in this condition in particular, we'll do an intra-articular injection, which is usually a cortisone as well as a numbing agent. And typically we like to see, at least some temporary relief of the hip pain, which can be both diagnostic as well as potentially therapeutic and giving us information that the problem is within the hip. And then, if those modalities aren't providing enough relief, that's when we consider surgery like a hip arthroscopy. And if you look at the images here on the right side of the screen, the image where my cursor is at in the bottom here is the white part of this is the ball portion of your hip. And this area here is an area where the arthroscopic shaver actually shaved away some of the bone here, because that overgrowth of the bone can cause impingement along the socket, and it can damage your labrum as well as your cartilage over time. And if you look at the top image here, that labrum has been repaired with a couple sutures that are holding it back in there. The next common hip injury that we see involves the hamstring tendons. So there's different varieties of hamstring tears, and you'll definitely, I mean, everybody's heard about them. Majority of these issues, a hamstring strain or a tear, usually involve the muscle belly. Um, so there's different muscles that are composed of the hamstring. It's a complex of muscles called the semitendinosus, semimembranosus, and the biceps femoris, which has a short and a long head to it. They're highlighted in this picture here. And it occurs during activities that involve sudden acceleration, deceleration, such as sprinting, jumping. You hear a lot of football players injuring this. And then, you can have more severe injuries in water skiers where they're suddenly jerked up from the water, when their hips flexed and their knees extended, puts the most force on this muscle group. And it can result in a lot of thigh pain as well as around the buttock region. Um, and even in the severe cases, which is when the tendons actually tear off from part of the bone up top here, it can lead to some significant bruising, which is concerning, and you should definitely seek some evaluation if that occurs to you. So the diagnosis, physical examination, and then we will typically get an MRI if we're concerned about the tendon pulling off the bone, not so much for the muscle belly injuries. But again, we'll start for the most part with conservative management, especially for the muscle belly injuries, with rest, ice, physical therapy, working on some gradual stretching of the muscle group, and then eventual strengthening and returning back to play. When it's a single tendon pulled off the bone, we typically will rehab those conservatively, or if it's two tendons that aren't too far off the bone, less than 2 centimeters, then we'll typically treat it non-operatively, and then pretty much all muscle belly injuries. And then the surgical issues is when a couple of the tendons pull far away from the bones, greater than 2 centimeters, or if you have a full 3 tendon pull off the bone, that's something that we try to have just do surgery to repair those tendons back to the bone, in an expedited fashion within a couple weeks or so. So it's important to seek evaluation if you ever have an injury like this. The third kind of most common hip injury is a conglomerate, commonly referred to as a sports hernia. And it's a bit of a misnomer because typically does not involve a hernia, but what it is an imbalance really of a couple different muscle groups. Your core muscles, one of them is called your rectus abdominis, and that attaches to your pelvis bone, as well as some of the muscles that pull your thigh inward, called your adductors. And really what's going on here is extreme amount of force going on that, or an eccentric force that's pulling those in different directions. And this injury is typically involved in kickers, so soccer players, as well as hockey players. With the stride that they have, they put some tension on their adductor muscles as they fully lengthen their stride. Um, and then in football, you see it sometimes, but it's mainly you see it more in the place kickers, maybe even the punchers. Um, and it results in pain along your lower abdomen as well as the inner thigh. This diagnosis typically made with physical examination, imaging. Typically, we'll definitely start with some conservative management, rest, ice, anti-inflammatories, some physical therapy targeting at strengthening the core out as well as the hip muscles. And then you can try different injections around the muscles that are injured, especially if you're in the midst of a sports season and you want to finish it out. Um, and then surgery is really considered after failed management of these conservative options. So I'd like to see probably about 3 months or so of conservative management. And with that, if that fails, however, the surgery can be considered. And typically, what you do is you repair that abdominal muscle back to the pelvis, or you can potentially lengthen your adductor muscle out and give it some relief of these muscle imbalances that are pulling against each other.